My name is J. Randall Wilkerson. I'm author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 9 of a 58-part video series. The first one begins with the introduction, and you can access all of them from our channel. The subject in tonight's section is potassium. It's the second supplement listed under Chapter 5. Potassium in itself is listed as value 1 critical, yet primarily because it's important for absorption of magnesium, the previous element. Potassium is a common mineral, often overlooked in treating heart failure. Generally, you need large quantities of potassium to enable the kidneys to regulate blood sodium levels and to assist in absorption of magnesium. For heart failure treatment, potassium reduces the back pressure caused by hypertension, so it's a key macro mineral for the regulation of blood sodium. When 360,000 Medicaid patients with heart failure were analyzed between 1999 and 2007, the overall rate of death was 9% each year. Among those patients who took at least 40 milligrams of a diuretic and also took a potassium pill had a 16% lower risk of death from heart arrhythmias. Those who took less than 40 milligrams of diuretics yet still took the potassium still have a 7% lower risk of death. So taking potassium alone does not explain all the subject matter. However, when taking ACE inhibitor drugs, you'll have to check the data sheet to see if potassium consumption in the form of a capsule or a pill is recommended. The most accurate method of checking to see your blood potassium, or at least your cellular potassium, is the EXA test, EXA from Intercellular Diagnostics Incorporated. They basically scrape some cells from inside your mouth, apply them to a slide, and then they are X-rayed in a fluorescent spectrum report, which will indicate the total potassium in your cells. This is the most accurate way to measure whether you need more extra potassium. Now, potassium consumption is best obtained through food because you need large quantities, thousands of milligrams. A single potassium orotate capsule might be 99 milligrams. So if you need 4,000, that's 40 capsules. You might need 10,000 just to regulate your blood sodium levels and therefore your blood pressure. So obviously taking it all in capsules is impossible. When the American Heart Association recommends reducing salt intake to the minimum, they do not take into account your potassium level. Later on, we'll get into the salt subchapter, salt and sodium, wherein minimum salt intake is not recommended because that had the highest mortality rate. In one clinical trial alone, 54 test subjects died because they did not have enough sodium in their body. The minimum target ratio of sodium to potassium should be 1:1, but the proper ratio is between 1:5 or even 1:7. That means for every 1,000 milligrams of sodium you consume, you should consume at least 5,000 milligrams of potassium. In the typical packaged food diet or fast food diet in America, that ratio is flipped. It's at least 2:1, 2,000 milligrams sodium to 1,000 milligrams potassium, but often much higher, 5:1, even 10:1. So that means if you consume 5,000 milligrams of salt, you're only getting 1,000 milligrams of potassium in packaged foods because the potassium has been removed. As your sodium-potassium ratio increases to the wrong side of that ratio, like 2:1, 3:1, 5:1, your blood pressure will increase uniformly. And this is based upon a study published in February 2012. The clinical trial is listed in our footnotes. Potassium-loaded foods may be a little bit difficult to find besides vegetables. It's easy to consume large amounts of potassium if you juice 8 or 10 servings of vegetables. 2 glasses of juice will have that. Coconut water is a new product available, and that provides 1,200 milligrams in a 20-ounce can. Joggers and runners often use it to replace electrolytes during competition. Other foods include bananas. They can contain anywhere from 400 milligrams to 500 milligrams typically. There's also more potassium in sweet potatoes, greens, spinach, mushrooms, lima beans, peas, peanut butter, oatmeal, tomatoes, cantaloupe, milk, yogurt, even some fish. So work with your cardiologist to stabilize your potassium level. This will keep your blood pressure low or normal, as long as you keep the foods in mind to keep the proper sodium-potassium ratio. I repeat, the sodium should be 1/5 of the potassium. My name is Jack Randall Wilkerson, and this is the Heart Failure Recovery Plan. Successful heart regeneration using metabolic enzymes. This book is available on Amazon, both in print and Kindle editions, at the Apple iTunes Store as in iBooks, also on eBay in print edition, and direct from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida, 32702. Just send a check for $24 and it will be shipped right out. Thank you.